University Medical Center as a level 1 trauma center is an important lifeline, not only for the Lubbock, but for the region. It was the place Julian Potter found life-saving care after a boating accident outside San Angelo. Here's his story.
We were tubing.
I was at work,
and it was too hard for her to turn, so the boat just flipped around and was heading straight for us on the tube.
And he tells me that there's been an accident at the lake.
And I thought I was far enough. I pushed off far enough, but I guess the wake sucked me under, and the propeller hit me in the leg.
Julian Potter is used to taking a few hits. The San Angelo high schooler loves to play football. But a day at Lake Nasworthy was one that would change his life and nearly take it.
Well, it just felt like a punch, and that's when I knew. I was like, okay, something hit me. And I picked my leg up out of the water, and I just saw my whole leg cut open.
When they pulled him out of the ambulance and I saw his leg, is when I realized how severe it was.
Brian, his dad, had followed them to a local hospital where emergency surgery was done to replace a damaged but vital artery in his leg, keeping him alive for the time being. And then word came.
We're going to have to airlift him to Lubbock, to the level 1 trauma center. He may or may not make it. He may lose his leg.
Julian would have to go by plane in order to avoid a storm. Brian couldn't go with them, but drove through the night.
And in my mind, I'm thinking, well, if I lose him, I want to be there. So that was hard. We didn't lose him. He didn't lose his leg. And here we are.
Thanks to the UMC hospital and its trauma surgeons, Julian's life was saved, and he was in the right place for care because there was still a lot of work to do.
I believe the final count was 9 surgeries.
From fractured bones to damaged arteries and nerves, much had to be repaired, and much was missing.
His leg was ripped apart.
Dr. Deepak Bharadia is a reconstructive surgeon. He says Julian was missing at least 25% of his quadricep muscle.
At that point, our main concern was if the nerve was still feeding the rest of the muscles, he could still compensate, at least enough that he could, one, have a normal functional life.
That functional life was not only top of mind for the team of doctors, but Julian, of course, and the team he was a part of.
Well, when I was on the boat, I was like, I can't lose my leg. I have football. And that was the first thing I thought. I was like, I'm going to miss practice.
For more than a month, Julian's life was at UMC, but thanks to child life specialists.
And they teach you a lot. If you ask the questions, they show you. And it was just them joking around with me made me feel comfortable.
And the continuing care has kept them close to Lubbock. Wounds have been covered. Physical therapy has helped him walk again, and toward an outcome that all are hoping for.
My hope and expectation would be that he goes back to playing football again, and I wouldn't be surprised if that happens.
It's a prognosis that wouldn't have come without the team at University Medical Center, and it's a prognosis that has this father and son excited.
It made me want to push myself so I can get to that.
Gratifying. Extremely. Just look at him. Just even, that smile. It means a lot.
What a story. On the wish list this year.